Thank you,
Okay.
Ed. Thank you a lot.
Thank you so much. Next, we have the session of question and answers with Professor Ed Benzel on how to become an academician. And for that, I would like to request Professor Michael Steinmetz to lead the session.
Thank you very much. So this is going to be hopefully a very interactive session. There will not be any slides. This is our opportunity as participants, especially the younger participants on this meeting, to ask Ed Benzel questions. The theme is becoming an academic spine surgeon or becoming an academician. And so I'd like to invite the audience to write their questions in the chat box, and I will attempt to moderate those questions and ask Ed questions. And I'll kick this off. And I think if we don't start getting some questions in, perhaps the other faculty can ask some questions too while we're getting people to type in their questions. So Ed, are you there?
I am here.
Ed, so I had recently seen an email that you had sent out about a book you and I are working on about someone from another country, and his quest in life was to become someone like you, and hoping to be someone like you as sort of the pinnacle academic spine surgeon. And I guess the question that I would ask you, and there's no specific, I guess not one specific answer, is if I am a medical student that is now just getting into orthopedics or neurosurgery, how do I start? Like, how did you start? What did you do early on in your career that helped you get to the point where you're at now?
Well, I really started as a resident working on manuscripts and research with Dr. Sanford Larson. And then early in my career, teaching and writing a lot. And it's just like the rock and roll group Rush's song, Roll the Bone. The key to hard work is the key to good fortune. And so I wrote often, I read a lot, and I spoke often. I didn't turn down when I received an opportunity to speak. I didn't turn it down. And I focused on having other people help me, which I literally refer to as hard work, hard wiring my environment, whether it be nurses on the ward or the operating room, clerical people, associates, fellow residents or medical students, and in turn, always treating them well to create an enriched environment around myself. And so it wasn't me who succeeded, it was all the people who assisted me throughout my career who succeeded. But I guess if I did anything, I put them in the position to help me and to want to help me.
Yeah, that's actually good advice. So where I think a lot of us fail at is getting the environment right around you so that you can be successful, which is very introspective. And I think you told me once, write early and write often, and I hear you say that as well. Certainly early on in your career is a way to advance sort of the academic aspect of our job.
So I have another comment here regarding preparation for talks or meetings and things like that. People will often say to me, oh, you're just a natural, you don't have to prepare. I'm guessing that for every hour I speak, I am preparing every time, 2 to 3 or more hours. I work hard at making sure I have all my T's crossed and I's dotted before I get on the podium.
Also great advice. To all the participants, please type in your questions for Professor Benzel so I can ask him. All right, I'm starting to get a few coming in. So a question that just came into the chat, Ed, is when you look at academia, it's both teaching and research. And obviously one person may not be as strong in both areas. How do you balance that? How does one balance being a good teacher versus being a good researcher, or trying to do both?
Well, I think both are important, but from a notoriety perspective, teaching and public speaking is probably the most important. I don't know how to balance that. I think you simply must do both. You don't get asked to speak unless you've written something, usually. I'd say the greater balance issue is the work-home balance. I like to say that we physicians need to be selfless and dedicate ourselves to our career, to teaching, to our patients, et cetera. But we also need to be, on the other hand, need to be selfish and striving to get home on time to be with family, et cetera. It's a tricky road to hoe.
Oh, very true. So that's the only question we received so far. Please, our audience, type in questions that you've always had interest with regards to Dr. Benzel. Okay,
So,
here's another one just came through, Ed. This is something that's dear to your heart. When you look at becoming a spine surgeon, should I go into neurosurgery or should I go into orthopedics? Which one is better?
boy, that could get me in trouble, couldn't it? Neither is better. This is near and dear to my heart because 20 years ago, we started a combined, over 20 years ago, started a combined ortho-neuro program with medical spine specialists, and every single person in that program, orthopedic or neurosurgeon or medical, puts their pants on one leg at a time. And we treat each other as equal. We are equal. We respect ourselves as equal. So my answer to that question is dealer's choice. In general, orthopedic surgeons come from a more mechanical, biomechanical slant, and neurosurgeons come more from a neuroanatomy slant. But at the end game of spine surgery, except for intradural work in most countries, both are the same, and they're becoming more and more similar. But I still think it's very important for us to have both specialties, because there are overlapping rings, the orthopedic ring and the neurosurgery ring, and each of those edges bring something to the middle that is very valuable. It's palpable in our program at the Cleveland Clinic.
Yes, that's a great way to present it. Now, so everybody knows on the call in our department, there's 9 of us that do spine surgery on the main campus, both ortho and neuro, and it's hard to know nowadays who's ortho and neuro. And I always joke, one of my partners, Tom Roz, who's an orthopedic trained spine surgeon, is much more of a neurosurgeon than I am with the type of surgery he does. So the lines certainly are blurred. All right, Ed, here's actually a very insightful question. So when we look at training today, the question's around neurosurgery, but I think it's equally applied to orthopedics, because everything is diversifying and sort of becoming a subspecialty type job. We're seeing residents have less time or less exposure to each of these areas. How does someone going to choose what area they want to go in as their exposure to those areas continue to diminish?
Well, I talk to students and young residents a lot about this. Interestingly, we used to take a look at graduation at the graduate's personal statement when going into the training program, and almost invariably, the graduating resident chose a subspecialty of neurosurgery that was completely different than what they thought they were going to do 7 years prior. And so my recommendation here is to flow with it. You know, it'll grab you, at some point. And if you're getting quite far through your training and it still hasn't grabbed you, then maybe you need to talk to some mentors. But usually keep your eyes open, because there are many things that people, particularly young surgeons, don't see yet, and hopefully they will see them as they meander through the educational abyss.
So Ed, here's an interesting question. If you were able to start your career over again, would you have done it differently?
I see Doug smiling. I'm looking for a clue here. First of all, the time and the place where my career developed doesn't exist in the United States anymore. I trained with arguably the first neurosurgical academic spine surgeon, Sanford Larson. I was arguably the first neurosurgery spine fellow under his tutelage after I graduated, the first year postgraduate. I went to Louisiana State University in Shreveport, and it truly was the wild, wild west there. I didn't work with neurosurgeons. I worked with orthopedic surgery residents, general surgery residents, ENT residents, and I created an academic and clinical mini empire, if you will, that was very productive. This doesn't exist right now. And there's fundamentally, when I talk to people about academic jobs, there's really two ways of looking at your first job. You go to it, one is to go into an environment where there are other specialists doing what you do, and you start at the bottom and work your way up. Or go to a smaller institution, which is more like what I did, and be near the top of the ladder from the very beginning, which requires a lot of work, a lot of time, and a lot of blood, sweat, and tears. That was the route I took. And I think young people going into practice out of residency fundamentally have those two choices. Very few take the hard work choice, though, these days.
Hey, that's fantastic. So some of the questions and comments that have come in are around mentorship. And, obviously you've been a mentor to so many, but when you look at it from, say, a trainee's side who's on this, what advice would you give them to picking the right mentor or an appropriate mentor?
I would probably not necessarily be enamored by the buzzers and whistles and bells and sparkles. In other words, the accomplished mentor may not be a good mentor. I would go with my heart and go with a person whose fundamental beliefs are doing what's right. Because what I would want is the guidance to get into my career, jump into my career with the greatest chance of being successful. I like to use the term doing what's right. It in the long run serves people well. If I could just describe a definition of leadership, which is more or less like a servant leader, and that is leadership is the art of causing others to do something they otherwise would not have done. And so developing those skill sets really requires of the person to have strong social and self-awareness skills. And so if a mentor can help a mentee develop those skill sets, that is perhaps the greatest gift a mentor could give to a young surgeon.
That's excellent. That's great advice. Ed, there's a question around, there's a couple questions around training as a spine surgeon. One is, you think we will have a future where spine surgery becomes its own specialty? And then sort of connected to that, but different, is as an orthopedic surgeon, as a neurosurgeon, we train to do so much, yet we limit it to spine. Should we in this field, should we try to do mainly spine and less of everything else? Can we find balance between doing cranial and spine surgery, or hip and knees and spine surgery as examples?
This discussion has been ongoing for decades. The gray hairs in both specialties, ortho and neuro, of which I am one, I guess, except I have no hair, have been very rigid. You know, we've got to preserve neurosurgery and you know, screw the orthopedic surgeons and vice versa. And yeah, it does seem a shame for someone like me when I was a rookie to learn how to do aneurysm surgery and pediatrics and tumors, etc. And then to not do that anymore. And honestly, my thought process is here. I do, on the one hand, think that we need to preserve the sanctity of both orthopedic surgery and neurosurgery. On the other side of the coin, if you look at most neurosurgery programs, we could finish our training in 4 years with the fundamental aspects of neurosurgery and be probably very well trained as a general neurosurgeon. And I'm sure that would be true for orthopedic surgery. Then possibly have fellowships be longer, where those research years don't occur. We have 2 years of research in our program, at neurosurgery program at the Cleveland Clinic. Then that research would occur in a 3-year or so fellowship. So less time would have been spent. Less, probably not so important time would have been spent in other aspects of orthopedic surgery or neurosurgery, and more time in training would be spent on spine surgery. But that's just my thought. I have no idea where we're heading down the road.
So Ed, let me perhaps ask one last question here, and so leave us a little bit behind, but this has been an incredible, valuable experience for all of us. And I'm trying to figure out how I will ask this to you, but you know, we're talking about becoming an academic spine surgeon. We're also today showed a lot of technical surgery that costs a lot and, you know, is fairly high, is fairly advanced. What advice can you give to those that are in resource poor environments where, again, it's hard to write because there's not as much support, nor are they really having the access to these higher, you know, these greater technological advances in spine surgery, and then it's hard to write about that as well. And since the question is sort of the standard of care, if we call it that, is now advanced beyond what certain areas can offer.
Yeah, I'm going to talk about this a little bit in the future of spine surgery at the end of this session today. First of all, I think all of us, need to really focus less on technology and more on thinking through things. And we used to call this divide first world, second world, and third world countries. And most of what we've been talking about today have been first world problems. They are not problems that are commonly addressed in middle income and low income countries. And yet the vast majority of the patient population of the world live in these countries. There needs to be some sort of redistribution of resources and intellect and restoration of and minimizing unnecessary operations or less than optimally necessary operations. And I'm going to address that in my final talk. If I could just in closing emphasize one word, and I think it has been exhibited throughout our sessions here yesterday and today, and that one word is fun. We need to make our work fun. We need to make our collaborations fun, because if they're not fun, we're not going to be as productive or achieve the heights that we otherwise would do if we just loosen up a little bit, take off our tie, put on our hat, and go to work in a positive environment.
Great advice. That's certainly advice we can all live by. So Ed, thank you so much for this. This is, I think, a session we could easily go on for an hour or two with the number of questions that have been sent through the chat room. People are really heeding your advice, and I think I can speak for all of us and say we appreciate it and appreciate all the knowledge and advice you give us as participants in this meeting. So on that though, let's close this session and let's move to the next.